Hello. Today we're here with Dr. Elizabeth Davidson. And Elizabeth Davidson is a holistic doctor, author, bloodwork specialist, clairvoyant, plant medicine expert, entrepreneur, forager, skier, and single mom. She's all the things. She believes that everyone's health is a puzzle, and she combines science and intuition to help people put that puzzle together to solve their chronic illness, feel their best, and live their best lives. So, welcome, Dr. Elizabeth Davidson.
Thank you so much for having me.
Yeah, thank you for coming to talk to us. First of all, I took a look through your Instagram, and it seems like you show up on there a lot in these beautiful settings with nature behind you and some gorgeous nature pictures. Can you tell us where you are coming in from today?
Yeah, sure. I am in northern Vermont, so I'm in the Green
Ah,
Mountains, and I live in a yurt up here, so
oh,
it's
wow.
extra naturey because yeah, it's a roundhouse in the middle of some woods with lots of flowers around it and a mountain.
Oh, that sounds lovely. Did you construct it yourself?
My daughter and I did, yeah,
Oh, that's so cool.
yeah.
Very cool. Was that a hard process or?
Well, it had its ups and downs. I'm not gonna say it was easy, but worth it, yes.
Yeah, very cool. I love it. Yeah, yurts. Yeah, and they've got that whole, circular thing going. So out, out the gate, it's aligned with cycles, isn't it?
Yes, I really like living outside the box.
Yeah. Speaking of outside the box, one of the things in your bio is clairvoyant. So I've got to hear about that, please. Can we start with that?
Sure. So clairvoyant means clear seeing. And I did a 2.5 year clairvoyant course, which is all about really just diving deep into your intuition and how to use your vision, your inner knowledge with spirit to make your life and everyone's lives better. And one of the biggest things I learned in that course is that we are all intuitive. We all have a level of clairvoyance. We just haven't, like, a lot of us haven't admitted it, or we haven't trained it. We haven't nurtured our clairvoyance and our intuition. But how it fits in with what I do is I feel like intuition is the key to our health and well-being, because we all live in our bodies 24/7. So we know them better than anyone else does. And if we
Hmm.
feel something is right with our bodies or wrong, or if there's something we should do or not do, then we're right, because that's our inner knowing. And when you really trust that, some people would call it a gut feeling. That's
Yeah.
kind of the basically what intuition is, but there are so many tools you can use to hone that and help it work better for you and express it. And that's what we learn in clairvoyant school. um,
Yeah.
we all have it, and I guess that's the biggest thing that adds to my life, is that I can help people tap into their intuition so they can make their health and well-being what they want it to be.
Oh, I love that. I love that. I believe in it. I'm a big believer in intuition. So I've got to ask the question because you have been to clairvoyant school, which is pretty cool. Do they teach you in clairvoyant school how to separate like fear-based thinking from gut feeling stuff, right? Because that's something I know I myself struggle with of this like yeah, what's the fear and then what's the real voice that's in there telling you when something is wrong?
So probably the biggest tool we learned for that is just being grounded.
Mhm.
So when you really just focus in on yourself and we talk about having a grounding cord. So a cord that goes from our like root chakra area down into the center of the earth, where anything that's fear or not true, or a picture of something that we don't want in our lives, or
Mhm.
that is something that isn't helping us be our best, all that can just go down the grounding cord and be done with it. So the first step to anything clairvoyant, intuitive, whatever, is just to be grounded. So
Yeah.
like a conscious grounding. Yeah.
Okay. Yeah, that lines up with other things that I've kind of consumed on that subject, and like meditating, and yeah, absolutely.
Mm.
That difference in the trying to hear the difference in the voice, right? And discern between
Mhm.
the deep knowing and then the more like in your head thinking, or in some cases also people are bringing their own experiences and traumas to the table as well, aren't they? And that can kind of shape how they're hearing or what they're imagining could be happening to them when it comes to their health.
And yeah, that's part of what we learned too, is that any of that stuff, like when you get really grounded, you can kind of separate it out and all that stuff can just ground off and you be done with it. And I like using some essential oils to help me with the grounding too, because it helps with that
Wonderful.
clarity and grounding. I use one in particular called Balance, which is the
Hmm.
grounding blend. And yeah.
How do you use it? What do you do when you use it?
I like to put it on the bottoms of my feet and I'll put some on my wrists, like pulse points on the wrists and just smell it. Or sometimes just smell it out of the bottle because
Mhm.
it's handy. Like I have it right there behind me.
Yeah. And just like while meditating or just in any kind of a calm moment?
um, yeah, whenever I feel like, well, if I'm feeling upset and I need to ground, then yes, obviously, but also do it intentionally, like before bed. I often do a meditation before bed or when I first wake up, those kind of times, or when I'm about to like teach a workshop or something, because
Mhm.
I teach a workshop every week. And so to get grounded before my workshop, it makes me be most connected with source or spirit, whatever you want to call that. And so I can be focused on what I'm doing in the best way and give the most information, inspiration to whoever listens to my workshop.
I love that. And what's the weekly workshop on?
A different topic each week. It's called the Weekly Wellbeing Deep Dive. It's on Mondays.
Nice.
Gets put up on YouTube also, so if you miss it, you can still hear it. But
Okay.
this past week was on autoimmune, and next week I'm still deciding, but I'm thinking about diving into hormones. So
Hey. You're pre-gaming it a little bit now.
yeah. But it's inspiring. Like, so that's another thing with like the clairvoyant course is you take things that happen in your life, like this podcast is
Mhm.
inspiring me to, oh, maybe hormones is the next thing that I need to teach about. And so it probably will be. I think it was
I
the
love
next
that.
one. I just haven't looked at my list. So
Cool. I'll be there.
it all fits together.
Or
Okay. Well,
watching it on YouTube after, depending on the timing. And we'll put a link in the show notes for anyone listening that wants to. We'll put a link to your YouTube channel, and then we'll have, website and all that contact information so they can find you and go to this wonderful weekly deep dive on health. Speaking of, I'm wondering if you can tell us a little bit about your own journey and, becoming a doctor that's focused on chronic illness, and yeah, what that looked like for you and how you pulled away from this traditional Western medicine route that a lot of people go down or believe is their only option.
sure. Um, well, I guess I was blessed to be chronically ill from the time I was really little. So
Mm,
that's
mhm.
what really steered me. But yeah, I started having migraines at age 4. I started having joint pain at age 7, bad enough that I couldn't walk that summer, and that turned into full blown fibromyalgia. Um, Along with that, I had a lot of immune troubles. So I got put on antibiotics a lot, which then destroyed my gut. And so I had a ton of skin problems. And
Mm,
this was all before I like started my cycle or anything like that too. So
wow.
by the time I started my
Wow.
cycle, I was just a total disaster. And so that wound up being a mess. And of course, when your cycle's a mess, they want to put you on birth control pills so that you
Yep.
eat every 4 weeks, which doesn't mean you're actually having a cycle. But of course, they don't tell you that. So I wound up being on hormones for a while and medications, whatever. Um, but I did recognize at a very young age that the medications that I got put on made me feel worse.
Mhm.
So I was like, well, what's the point if I feel worse whenever I take these? This doesn't make sense. So I
Yeah.
started refusing to take them. And that's what really spurred me to start looking at other options. Like I started studying plant medicine when I was 10 because I was like,
Wow.
this stuff is working for me. And that just continued, as I had more symptoms and was prescribed more things, that just continued. So I started with plant medicine. Then I was going for acupuncture when I was like 15,
Wow.
and and then I did all kinds of other things, like you name it, I've probably tried it. And one of the things that helped me get out of having daily migraines was really gentle chiropractic care. Like I'm not talking about twisting and cracking. I'm talking about like network chiropractic care, biogeometric integration kind of stuff, which is super light touch, really works with helping your nerves function better. And so
Okay.
your brain and your body can connect better rather than putting a bone back into place. So that inspired me to go get a chiropractic degree, which I didn't
Nice.
realize how intensive of a medical degree that was until I was like going through school. And I was like, really? I need to know all this just to like touch people?
Yeah.
But
Yeah. And was it a very Western kind of orientation or I mean,
well, that's the big divider between like Western medicine and chiropractic school. Like the schooling is very similar, but the philosophy is totally different.
okay.
So what you get like when you go to an MD or a hospital or whatever is very mechanistic. You know how it looks at one part. Like
Mhm.
there's so many
Yep.
specialists. Like you may have like the ear, nose, and throat specialist, and they're going to look at your ear, nose, and throat,
Yep.
not connect it to anything else, whereas it is connected to everything else.
Yeah.
And chiropractic is based on the philosophy of vitalism, which means everything's connected.
Okay.
And so that was the big difference, like very similar classes and stuff, but from a different standpoint, that vitalistic standpoint where everything's connected, everything works together. If one thing's not functioning well, then nothing else is going to function at 100%. So we want
Mhm.
100% function, that kind of thing.
Hence holistic,
Yeah.
right? A holistic approach. I have a little question before we go on here about you talk about trying out these really amazing things even before you reached menarche and so did you have a supportive family that was taking you to acupuncture and what did that look like for you?
Well, I've always been quite driven.
Uh-huh. So you
And
had to be a self-starter with finding your
yeah,
solutions?
and stubborn and all of that. But you know, yeah, my mom was pretty open-minded, I guess. Like she was always more of a natural solutions kind of person. Like we never had, like chemical shampoo in our house, and
Oh,
we
wow.
we grew most of our own food and that kind of thing. So she was, and we had supplements, she was always open-minded to that kind
Right.
of, still is. I shouldn't say was, she still is. Um, I'm
So it
still,
wasn't outside the realm of normal for her that you were this kid, this young kid, really wanting to explore alternative treatments for your pain.
well, I've always been outside the realm of normal, um, but she did humor me, and a lot of it was just driven by myself. A lot of it she doesn't even know that I did. I got a driver's license as soon as I possibly could, and guess where I went? Like the chiropractor.
That's hilarious. I would love nothing more to have children that were, like, really into, like, alternative healing modalities.
Well, I
Not
suffered a lot as a kid,
yeah,
and when you're physically suffering, it's not just physical. It's
yep,
social, it's emotional, it's mental, it's everything. I mean, if you have a migraine every day, like I
yeah,
did, you can't really connect with your peers because you're always like behind this fog. And when you can't connect with your peers, you're always like a step behind socially. And it
mm,
affected everything. And so I was always searching for something so that I could function in my life, because I have a really good brain. Like, I knew I was smart. I just,
Yeah. Sounds like you were very smart to not kind of fall into that, I don't know, some kind of like low self-esteem. It's never going to be any different than this, but like, hey, I have this hunch there's something else out there that could maybe help me, and to keep looking for it.
yeah, not to say that my self-esteem has always been the greatest,
Sure.
but I've still always been driven to find solutions for health and well-being. And of course, as I've gotten older, it's become bigger than just me, like,
Yeah.
um, seeing how many other people struggle like I have, and, really wanting to make a difference. And
Yeah.
then having a daughter of my own and not wanting her to go through what I went through, because I didn't want to have kids for a really long time because I was such a sick kid. I hated being a kid. What I really hated is when people would tell me it was the best years of my life, because it felt
Mm.
terrible all the time. And I was like, well, what's the point? And
Yeah.
so I didn't even entertain the idea of having a child until after I graduated from chiropractic school, because then I knew that I had all these tools that I could raise a healthy child, and that our innate intelligence is there. And if we keep it turned on all the time, it will keep us well. And I knew so much more about how I could go about that than, I just had so much better tools than like my parents had.
Yeah, of course. Yeah. That's really beautiful. What was the kind of path then from, so you're graduating from chiropractic school, you obviously have this huge uh internal drive to kind of heal yourself with these alternative air quotes modalities. Um what led you then from chiropractic school graduation to working in the way that you are now?
Well, I did have a hands-on chiropractic practice for 14 years, and
Okay.
it was mostly a pregnancy and pediatric practice.
Hmm.
And so that's just such an interesting, group of people to be seeing regularly, with all the hormonal things that are going on, and all the health stuff that comes up when you are either trying to get pregnant or are pregnant or have a newborn baby. And I loved helping the babies, especially, like, get off to a really good start,
Hmm.
because
Yeah.
pregnancy and birth, it's kind of traumatic. So it's
Can be for
important for
sure.
babies to get their spines checked out as soon as they're born, because it's a connection between their brain and their bodies.
Mm.
Um, and so I was always like kind of chiropractor plus. I did a lot of, like, sort of probably health coaching, I guess is a good way to say it, as in,
Mhm.
like, advising people on what other things they could change in their lifestyle or add to their lifestyle that would be supportive of their well-being. And then COVID happened, and suddenly
Oh, yeah.
people weren't coming for in-person appointments anymore. And I wasn't allowed to touch people for a couple years. Vermont
Yeah.
is very strict about that stuff. So, being a single parent, and a homeowner, I had to transition pretty quickly because I had to keep paying the bills. So I started doing things virtually. So more of like the kind of health coaching. I use essential oils, so advising people on that. So that's part of my plant medicine expertise. I just find it's the
Mhm.
simplest way to use plant medicine because it's in this cute little bottle that's really convenient.
Yeah.
And then I got the functional blood work certification,
Hmm.
so that I can read people's blood work
Oh,
from a
wow.
functional standpoint rather than from like oh, your numbers are all in normal ranges, you're fine
Yeah.
standpoint, which is pretty
Like,
typical.
is that the functional standpoint would be like, okay, this is what your blood is telling me about your health? Is that?
So a lot of people who get blood work done, like especially people who have a ton of symptoms, lots of times their blood work's totally normal if you only
Mm.
look at the normal ranges, which is what medical doctors tend to look at, is just the normal ranges. And so the functional piece is more about, I mean, yeah, I look at normal ranges, but it's also about the relationships between the numbers. This is kind of
Yeah.
the underlying things and what those numbers actually mean.
So you kind of, what you're looking for, and that's gonna be a little different than what a regular doctor would be looking for.
Yeah.
Okay.
Like, for example, I recently had a client who got diagnosed with lupus, which is an autoimmune disorder that is really bad on your connective tissue, joints, all of that stuff, along with many other symptoms. And she has a lot of the symptoms, but the diagnostic, like the main diagnostic criteria in your blood work for that is called an anti-nuclear antibody.
Okay.
So it's an antibody. And when I looked into her blood work, I was looking at her white blood cells. There are 5 different types of white blood cells, and each indicates a different type of infection. Her white blood cells indicated bacterial infections, fungal infections, parasitic infections, and viral infections.
Wow.
No wonder her antibodies are going crazy, right?
Yeah.
So what happens then when we take away those infections, and then are her antibodies still going to be going crazy? Is she still going to be having those lupus symptoms? Well, in my experience, no. Once you get rid of those infections, then you're fine. You don't have the autoimmune disorder anymore. And so it's just a different way of looking at it, because a typical, like a lot of times the medical doctor doesn't even order the differential on that. So the differential means the white blood cell count, but then broken up into the different types of cells.
Yeah.
A lot of times you'll just see the white blood cell count and the red blood cell count. And that doesn't give you the information you need to find what kind of infection is going on.
Yeah. That is really interesting. Thank you so much for sharing that example. You're really showcasing your knowledge here.
It's so interesting and so powerful, you know, because so many people more and more are getting diagnosed with autoimmune disorders
and things that like Western medicine doesn't seem to understand, right?
Yeah. And when you go get that diagnosis, then typically Western medicine just wants to put a medication on it to mask your symptoms. And I'm all for getting rid of symptoms, sure, but I would rather do it by getting to the root cause and getting rid of the cause so that you don't have the symptoms anymore. And what I find over and over again with autoimmune and chronic illness is all those infections that show up in the white blood cell counts. So
it's kind of reminding me of like ID doctors, infectious disease doctors, that get in there and have to really look at what's going on inside someone.
Yeah. I mean, the beauty of it for me is I don't even need to order the blood work usually. Like most of the time people have it. And so I just can analyze the numbers and then create a protocol for someone to get well. So, yeah.
That's really, really powerful. And you've got some success stories from that, I imagine. I mean, you've been doing this kind of work for a while.
Yeah, I just did a follow-up this morning, actually. She's starting her 5th month of my program. So she's been doing her protocol for 4 months. And her autoimmune disorder is called hemochromatosis, which is a pretty rare one. And nobody really knows much about what's going on with it.
Okay.
But basically, you have too much iron in your blood. And so it makes your joints hurt. It causes lots of itching and inflammation and stuff like that. And the only relief a lot of these people get is by donating blood, like getting blood drawn, which can be a lot to do. Like especially if you have to do it like every 2 weeks in order to have relief. And so when I looked back at her history, she had a bunch of traumatic stuff happen right around when this started, which often emotional trauma can put you into that autoimmune pattern just because it like opens your body up for attack, really. And so I saw the infections in her blood. We treated them. It was interesting. It's interesting how a lot of the autoimmune things look the same in the blood work, but individuals express them differently. So we treated the infections with herbal supplements. And 4 months in, and she is amazing. Like her energy is better than it's ever been. Before, if she ate anything straying from a very clean diet, she would immediately be itchy all over her body. And she was talking about like eating frozen pizza and drinking Swiss Miss hot chocolate and not having any itching. Like,
wow.
And so she's just functioning so much better. I mean, I just see her on Zoom because I have a virtual practice,
Mm-hmm.
but her face looks more toned, her skin looks better. Like everything just looked so much better. And her energy is amazing. And she wants her whole family to get care now. I mean, she already got her daughter started a while ago, but so yeah,
That's really cool.
it's amazing. And I've known people with hemochromatosis before that they never find a solution. They just feel terrible for the rest of their lives.
Mm-hmm.
And this was just as simple as, helping her clear out those infections. So,
That's really cool. Have you worked with anyone that's been diagnosed with Lyme?
oh yeah.
Yeah. Is that a big population that comes to you?
Well, I'm in the Northeast. And where are you?
Oh, I am in Atlanta, Georgia.
Okay. So Northeast is where like Lyme started. It's named for Lyme, Connecticut.
Oh, wow.
Yeah, so lots of Lyme. I mean, I worked with it a lot as a chiropractor because it attacks your nerves in your
Mm-hmm.
brain, and chiropractic care can really help with that. But now I just have like a more like full protocol for that. So yeah, definitely
Okay.
Lyme. And that's just it's a parasitic infection.
Yeah.
So another one of those infections that can add into your whole health history. And those parasites are really hard to get rid of. So
Yeah.
yeah.
All right. Well, listeners, hear ye, hear ye. Dr. Elizabeth Davidson, give her a try. Like I said in the show notes, you'll see how to connect with her if you've got some blood work you want analyzed. It sounds like
Yeah.
she knows her stuff. But speaking of knowing your stuff, how do you get from chiropractic medicine, chiropractic doctor to having this level of understanding about what's going on in the blood and what these infections are?
Oh, I can't seem to quit taking classes and stuff and getting certifications. And like, I feel like my chiropractic degree is kind of the foundation for my education. Well, except I had a teaching degree before that. So that was the
Nice.
bigger foundation. But like, I've just been studying my whole life. So I did the functional blood work certification. And but I already had a pretty good understanding of all of that stuff just because I've been studying herbal medicine, nutrition, mindset, emotional well-being, all kinds of I studied a lot of microbiology in chiropractic school too. So I just have a pretty big background. And so getting that certification was like, oh, this is the next step. It just makes sense.
I love that.
Yeah.
I really love that. Well, tell us, so hormones, that's one of your things. How do hormones play a role in our health from your perspective?
Oh, wow. Well, hormones
Big
pretty
question, I know.
well, they run a lot of things.
Mhm.
They run, I mean, hormones, when I talk about hormones, there's like your female hormones or your male hormones. There are those.
Sure.
There's a lot of other hormones too. Like your hormones run your digestion. They run your energy. Like there's hormones in all of that stuff. So the endocrine system is the hormone system, and it plays a huge role in pretty much anything that we do all the time. So making sure that it's working really well is quite important.
Yeah. Well, yeah, I definitely that's huge. Here at 28ish, we're all about kind of raising awareness around the sex hormones and that alignment with those different phases of your cycle, the menstruation, follicular, ovulation, luteal, these different phases. And I've always suspected, just because of how cyclical I am and how it maps into every area of my life, I've always suspected that with chronic pain, that there's kind of a merry-go-round as well that's connected to that hormonal cycle. In terms of maybe spiking and dropping at different parts of the cycle. Have you seen anything like that in your work?
Um, I've definitely had some clients who have noticed that things get worse, like at various points of their cycle. Yeah. Um, but for some of us, it's just like pain all the time. One thing
Yeah.
that kind of bugs me about like typical knowledge around our cycles, though, is that we have to have a lot of symptoms with it, like
Mm.
like
Tell
PMS,
tell us more about that.
cramps, emotions, all of that stuff. Like all of those are signs really that your hormones aren't very balanced.
Mhm.
And so like when I my daughter's 14, and so
Okay.
a lot of the moms that I know are their daughters are heading into that,
Yeah.
menopause
I have
age.
2 soon to be 13-year-olds.
Wow.
Twins.
Yeah,
Yeah.
that's exciting.
Yeah. Yeah. It's a lot.
But it's interesting to me, just the expectation that their girls are going to have, big emotional ups and downs around their cycle, and that they're going to have cramps, and that they're going to have fatigue, and that they're going to be, moodier and exhausted and not want to get up around their cycle. And um, I don't, that doesn't have to be true. Like those are
Yeah.
signs that things that kind of work with your cycle, like your blood sugar balance,
Mhm.
and probably your fat, your level of healthy fats in your body. Those two things, especially, that those aren't at their best.
Mhm.
I love having my daughter as like my test case
Yeah.
because I've raised her to be super super healthy, and yeah, she gets no symptoms. She's had her cycle now for over 2 years. She has no symptoms around it. It's a little annoying for her because she doesn't know when it's going to start.
Yeah.
um, but she's never had cramps. She's never had the fatigue. I mean, she might sleep a little bit more, like right
Mhm.
around when she gets it, but like not to the point where you'd really notice. And she doesn't really get extra moody. It's really nice.
Yeah. Yeah, no, I mean, and it sounds like you said, you've got this a very positive spin or focus on health within the home as well and within her life.
Yeah.
One of the things I try to do with my daughters is, like you said, challenge the idea that it's a given that they're going to be in pain, and even as little as like this thing of like we have to eat chocolate when we're on our periods or something like that, right? I'm like, no, oh, your period? Okay, cool. Let's get some dark green juice, some dark leafy greens in you. That's going to make you feel good. I try to like plant these little ideas in their head to associate certain parts of their cycle. I do notice though with the teens, and this would be interesting to hear your take because I know that you work with teens a lot, that the cycle for them, their awareness of the cycle is so much smaller than uh, than let's say women that are in their 30s or above, or women that have gone through the birthing experience, one of these life initiations like giving birth. That's when a lot of women come into this cyclical awareness, and it seems to me that the younger ones, it's like the actual bleeding time or maybe just before is really their kind of focus, and then the rest of the cycle they're just off to the races. Whereas like even as you're older and aging, and your hormones and those other parts of your cycle are really kind of maybe having a larger effect on you. Do you think that's accurate, or do you agree with that?
Yeah, I would say so. I mean, well, especially like I would hope teenagers, they aren't really thinking about ovulation and stuff like that.
They need to be.
I know, but I think that's a big like cultural lack that we have too, is just educating girls
Yeah.
around what's actually going on. And
Yep.
maybe if there's more education around that, they would have more awareness of what was going on at different points of their cycle or care more.
Yeah.
But
Care more. Yeah. Yeah.
It starts to mean more when you throw in that pregnancy thing, like, oh,
Yep.
this cycle is so I can get pregnant or not get pregnant. And, you know, hopefully 13 and 14-year-olds don't have that on their minds.
Yes.
So,
True. But I would love to see or be a part of, planting this seed for them that, I don't know what is a 13-year-old worried about? It's socially, really. I think that's the biggest things. But let's say some of the responsibilities they have on them, some of the things they have going on in their lives would be maybe around schoolwork or some kind of learning, right? And how they might show up differently for the way that they're working, how their habits and the way that they are conducting themselves in general are going to be affected by this, kind of monthly ride that we're all on.
yeah. I mean, I think so. One thing that I really like is that we now do have like tracking apps for our cycles.
Yes.
Thing that was weird is my daughter started when she was just shy of 12, and a lot of the tracking apps you can't start using till you're 13. It's like,
Mm,
okay, problem. I couldn't find any that you could use before age 13. And a lot of them do have like emotions and stuff that you can track on there too, which
yeah.
I feel like if we did a better job, maybe as moms, tracking
Mhm.
our own, because I'm not that great at tracking my emotions, like, or my productivity throughout my cycle. So I know it's a
Mhm.
thing, like it's in the back of my mind, but teaching girls that, we are on a cycle. It's not, yeah, like you said, just the bleeding once a month-ish.
Yeah.
Uh,
Yeah, well, it is that thing, right? There's a lot of look, it's not covered in sex ed for sure. Not. Like who's telling them this, I one of the beautiful things that I'm seeing world over, especially in the West, there's a huge new focus on like period positive, there's a period positive movement, and I think like I can see such huge leaps forward in that area even from the time when I was a teen. It's like a completely different landscape, way less stigmatized. But people still aren't talking about the cycle. It's all about the period.
yeah,
So,
it's true.
yeah. And often, I've given workshops to rooms of teens, and the thing that I hear the most is we didn't know that there's a cycle. Like we thought that it was just a period. We didn't realize that we're changing.
Oh, wow. Yeah,
Yeah.
that's interesting.
Yeah. So,
I mean,
all right. Well, so hormonal imbalance, is that one of the things that people come to you with for guidance on that?
for sure. So all kinds of things like, well, often especially when girls are first starting their periods, they're not very regular.
Yep.
Um, and the first thing that the MD world wants to do is put them on pills. So,
To try
which,
to regularize it? To try to
yeah, so they bleed every month,
wow. That's
just totally overrides the
astounding.
cycle, as you know,
Yeah.
because it just doesn't, they put them on birth control pills so they have a regular period, but there's no cycle involved. So it's just dumb. It's like the stupidest thing ever, I
I
think.
think there's finally there's some pushback coming out around the birth control pills. Some awareness building in society because that's crazy.
And then people celebrate like they don't want to get their periods.
Mm,
So they get stuff like the implants and shots. Like I was talking to a mom whose daughter's on the swim team, and one of the
mhm.
options for her daughter, like rather than, use learn to use a tampon and wear
Tampons,
it,
cups. Yeah.
up, whatever,
Yep.
was just get the implant so she wouldn't get her period anymore.
God,
And
that's
the mom was
crazy.
like,
Yeah.
well, what? But the daughter was like, well, that sounds awesome, because
Yep.
she wouldn't have to worry about it while swimming and stuff. So yeah, there's so much education to be done about how important the cycle is, and that it's not just the period. I'm so with you on that.
Yeah.
Um, But, oh, I'm getting a thunderstorm. Let me
Oh,
know if sound gets messed up.
was that some Vermont thunder?
Yes, Vermont thunder.
Very cool.
And so hormone balance is super important, and it's something that a lot of us don't have. And so I'm going to start from, I guess, like teenagehood on,
Mm-hmm.
because there are so many things that happen as we get older, like polycystic ovarian syndrome and endometriosis and stuff that all comes from this lack of hormone balance and can really mess it up. And then the infertility that a lot of people struggle with and all of that. But that can start at a young age. So I think irregular periods for the first few cycles is totally fine. And then there's, of course, how do you define regular? Like,
Yeah.
periods.
Everyone's cycle is different.
Your podcast is called 28-ish.
Ish. Absolutely. It's an ish.
Mine still tends to be more like 33.
Yeah.
Like, that's how I've pretty much always been, except for the year after I stopped breastfeeding. It was every 28 days, but for a year, it's like, okay,
yeah,
sure, whatever you say, body. But one of the key things to having your hormones balanced properly is having your blood sugar be stable. And that is something that a lot of people don't have. And I feel like it's especially challenging for teenagers for several reasons. One, because they're go, go, go all the time.
Yeah.
Like, you got school all day, you don't have probably great meals at school, then you got sports afterward. Maybe you're drinking an energy drink or having a protein bar sometime in there, maybe. But like, go, go, go all day. And not just to say teenagers, but a lot of working moms too. I know, I've been there. I used to have a very different schedule, and I wouldn't schedule in my lunch break because I would go, go, go. It was like, oh man, I need to schedule in my lunch break. That's self-care.
Well, and then you're just grabbing whatever's available, right? If you're not making a conscious effort.
And that's the other thing with teenagers, is they don't know a lot about nutrition.
Mm-hmm.
I mean, a lot of people don't know a lot about nutrition. I'm not saying just teenagers, but they tend to go for more convenience foods, fast foods. Like, I hung out with my 13-year-old niece the other day, and she had hot chocolate and a chocolate chip cookie for breakfast and French fries for lunch. I'm like, that's all just sugar, which totally messes with your blood sugar balance. And, there's a lot of pressure still on girls and women to be thin. There's a lot of myth on what foods will keep you thin, and like, eating disorders and starvation, even if it's not to the point of anorexia. But if you're just having an apple for lunch, your blood sugar is going to be a mess. And so nutrition, super important. And the other thing is that, like, so girls don't want to be fat. And so there's this myth that fat makes you fat. However, like, healthy fats are so important for your hormones to work well. And healthy fats often go hand in hand with cholesterol. And I don't know how much you know about how hormones are formed, but the base for all your sex hormones is cholesterol.
Okay.
And cholesterol is only found in animal foods, and particularly the fattier ones, like a good grass-fed steak that has some good cholesterol. Eggs have some good cholesterol, but you need cholesterol in order for your hormones to work well, because it's the base for your hormones.
So what are all the vegetarians and vegans of the world to do?
Well, I mean, vegetarians, at least hopefully you're getting some eggs and maybe some dairy that's a little bit better. But vegans, your hormones are probably a disaster because you don't get cholesterol, and you need cholesterol. It's the base for your hormones. I don't think vegan is a sustainable way to live as a human. So yeah, there's a lot of nutrition misinformation, and then just the body shaming and stuff that teens get, especially, that doesn't support them having healthy hormones. And if you, like I said earlier, it's easier to stay well than to get well. So start out with healthy hormones, it's easier to maintain that.
Mhm.
And a lot of us just aren't starting that way.
Yeah. I know with my daughters, I worry about their nutrition all the time, but it's that whole thing of I'm also trying to take care of myself and take care of them and do all the things, right? So I can't we make sure that there's one healthy, meal at the end of the day together. So that's something and that I can kind of control a little bit better most of the time in terms of making sure that it's balanced and healthy for them. But I worry about how they're eating all day and what they're grabbing along the way. And yeah, I think they're both complete and total sugar addicts. So one of my things that I've wanted to start doing is, and I actually bought all the supplies, and we're going to do this. I've got a juicer, and every morning making a green juice for them, having our certain cups for it, and on the way to school they drink it because at least then they're getting a hit of that nutrition and green in to start their day. And I feel better about that.
um, and yeah, like you said, the sugar addict thing, I find that so typical in the teens that I know, especially. I mean, lots of people, but it does not help your hormones at all. Like
Yeah.
sugar is probably the worst thing you can do for yourself when it comes to
Oh,
hormones.
yeah. Well, hormones, and then that impacts, the acne and the mood and all of it. Yeah, it's all related.
Yeah, it's all connected. And if you're having big mood swings along with your period, then it's
Mhm.
likely that your blood sugar is unstable, and that's why. And by stabilizing that, the mood swings go away.
Okay. What's your top tip for stabilizing the blood sugar levels?
Well, I do have a supplement that I often have people use that
Okay.
it's called Sinulin. It's not something you can just buy. You have to like get it through a practitioner, but
Mhm.
it's amazing for stabilizing the blood sugar. But diet wise, um, starting the day with protein,
Mhm.
really good. Um, when you have a sugar craving, eat protein instead.
Okay.
Um, though that's huge. So here's a little kind of analogy. So so when it comes to foods, like do you know how to start a fire? Are you decent at starting a fire?
Oh gosh, I struggle with that.
Okay.
I know it's a thing.
Well,
You've got to stack it very patiently, right? Yeah.
you know that paper burns really fast.
Yes. And then
And
the
so,
wood's not totally caught on fire yet, right?
yeah.
So,
So you
yeah.
light the paper, it burns up in a big flame, and then it
Yeah.
goes. You light the little twigs, they burn
Yeah.
up, and they burn a little bit longer, but not very long, and then they're out. But once you
Yeah.
get that log going,
Yep.
it can burn for a long time and put off a lot of heat and last you for a long time without a lot of effort. So when it comes to food, sugar is like the the thinnest paper that burns the hottest and the fastest. And so
Okay.
it launches your blood sugar up and then you crash. You've probably had a blood sugar crash before. Doesn't feel good.
Absolutely.
So sugar's like paper when it comes to building a fire. And the idea is that you want to build a good, strong fire. And then if you get into more like kind of complex carbs, like maybe some whole grains or something, that's, you get a little more sustenance there because there's a little bit of protein in there. So that's more like the twigs, the kindling, the really tiny kindling. So you get a
Okay.
little burn there, but it doesn't last you that long. But when you get into stuff like proteins and fats, healthy fats in particular, which I have a guide for what healthy fats are, I can give that out as a freebie to anyone who listens. I'll send it to you.
Okay.
Um,
Great.
so proteins and fats are more like the logs. So once you get those in there, they can last you for a long time and sustain you so that your blood sugar doesn't go up and down like crazy. Because having
Mhm.
your blood sugar go up and down all the time, it wreaks havoc on your whole system, not just your hormones, but those take a big hit, but it wreaks havoc on everything. And including your moods, your productivity, your ability to concentrate, to get through the school day or the work day or whatever it might be. But so getting those like more sustainable nutrients into your body.
Mhm.
And fruits and vegetables are kind of in that light carb area.
Okay.
They have some nutrition in them. They have vitamins and minerals and stuff like that. So that's better than just sugar, but they burn up pretty fast. They don't sustain you for very long.
So you think we should be doing more like protein smoothies in the morning than than green juice? Would that be a recommendation?
I mean, I would highly recommend like definitely having some protein in there. I mean, you could put the juice into a smoothie with some protein. Yeah.
Mhm.
Or even if they just ate like 2 eggs along with their juice or something,
Yeah. Yeah.
just to get some protein, because the juice doesn't really have any, it'll launch your blood sugar up and then down. It doesn't have any
Yeah.
sustainability as far as blood sugar goes. Yes, it has vitamins and minerals, and that's fantastic. Awesome.
Very important. Yeah.
But its effect on blood sugar is more like sugar because it's concentrated like that. So the protein is what's going to stabilize the blood sugar more.
All right. So proteins and healthy fats. Got it.
Yeah.
Okay. Well, thank you for that tip. Well, one more quick question before we begin to wrap it up. Are you big on this concept of intermittent fasting as a blood sugar stabilizer kind of thing? People talk about that.
I haven't heard of it as a blood sugar stabilizer as much as a weight loss tool. But think, if it feels
Isn't it meant to help with insulin resistance, help to overcome insulin resistance through the leptin?
yeah, I mean, if you're eating good foods, insulin
Mhm.
resistance shouldn't be an issue. When I say good food,
Okay.
like clean eating, not processed, very low, if any, sugar.
Mhm.
Um, and when I say sugar too, like a lot of things like simple carbs like pasta, bread, all of that, French fries converts right to sugar. So those aren't
Mhm.
very stabilizing. Um, I think if intermittent fasting works for you,
Yeah.
then awesome. That's the biggest thing with health, I find, is finding what works for you. And that's where that intuition, going back to the beginning, where that comes
Yeah.
into play in a huge way. So when I work with clients, I give them a lot of recommendations. I'll give them a protocol, but also ask them to tune into their intuition as I tune into mine, because I can help intuit what someone is going to need and benefit from on an individual level. So
Wonderful. Well, Dr. Elizabeth, thank you so much for sharing all of this very helpful information with us today, as well as your own kind of personal journey on getting here. I'm wondering, you mentioned you have a course, you have a book. Like, how can people engage with you besides sending you their blood panels?
well, probably the easiest way to access all of that is just on my website, which is drelizabethdavidson.com. So it's Dr. just Dr. Elizabeth,
Okay.
spelled with a Z, and Davidson with both the D's.
Okay.
drdavidson.com. There's plenty of spots where you can link to my scheduler. So if you want to get on
Right.
my schedule, there's that. And there's also a link to my book and a link to my course on there.
What's your course about?
It's called Banish Chronic Illness and Reclaim Your Life.
Wonderful.
Yeah. So it gives the basics on looking at your own blood work so you can get an idea of what's going on, and introduces some protocols that you can use, and I can help you, get the stuff you need for that. And then a lot of stuff on just maintaining your well-being once you regain it. So a lot of the gems that I've accumulated over the years, all in
Yeah,
one place.
I love that. And your book, what is your book called?
It's called Optimal Family Wellness, and
Okay.
it's on Amazon. There's a link on my website. So
And
yeah,
it's optimal family wellness. So is it for the whole family?
The idea is that it's for people who are getting ready to start a family. So you can
Okay.
prepare really well for pregnancy, because if you're prepared for pregnancy, you're likely going to have a healthier pregnancy and therefore a healthier baby. So you can prepare really well for pregnancy, birth, and then, having a baby and a toddler, and then going on from there. I wrote
Wonderful.
it a few years ago, so it doesn't have all of my current knowledge in there, but it's a good primer and it's a quick read. So,
Wonderful. Okay. Well, thank you for sharing that. And thank you for sharing everything today. Thanks for coming.
yeah, thanks so much for having me. This is really fun. And thanks for, diving deep into cycle awareness, because it helps us connect and ground with who we are. And when we connect and ground with who we are, we can really optimize our lives and our contribution to the world, which I think is important.
Yeah. Thank you. All right. Bye bye.